Cardiac amyloidosis is a condition affecting over 300,000 people globally with rogue protein invading the heart. This condition has long been a diagnostic puzzle, a diagnostic zebra, so to speak, but hope is on the horizon. In case you missed it, the FDA has approved BridgeBio Acoramidis, which is also known as Attruby, and that drug is a transthyretin stabilizer, revolutionizing care for ATTR-CM. And that's not all. Vutrisiran, a promising RNA interference therapy, is making way by reducing TTR production and cardiac events for ATTR amyloidosis patients. Its breakthrough are saving lives and driving innovation.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drug to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week Open Mic webinar. Topic for this week is amyloidosis, and we're honored to have our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, to do the presentation. He's also licensed cardiologist, also medical director of Baycare Medical Group, and they're a very big hospital group down in Florida.
As you know, amyloidosis is a condition where the amyloid proteins being accumulated in organs and tissue. So people would ask, what is amyloid protein? It's really an abnormal protein that has been malformed and then deposit into our organs. And these conditions have been going on for several thousands of years. As you can see, several organs can be affected: the heart, the kidneys, the spleen, nervous system, digestive tract. As you see on this diagram or this cartoon, you have normal ventricle with normal myocardium on the left side there, and then you have the amyloid protein deposit into the myocardium, result in the heart become thickened and ultimately malfunction. As you can see, we have two types of congestive heart failure. We touched on that before. One is diastolic heart failure and one is systolic heart failure. Diastolic heart failure occur about 50% of congestive heart failure syndrome. It's just like the systolic heart failure from weak heart occur about 50% of the time as well. So systolic heart failure occur because the heart is weakened and dilated, whereas diastolic heart failure, the heart is stiff and thickened, so result in the blood not able to fill the left ventricle chamber completely before the heart pump again. As you see, the etiology of amyloidosis here, we have from abnormal light chain formation from the bone marrow plasma cells, or the other possibility would be the misfolded transthyretin protein that can occur either by genetic hereditary condition or wild mutation that being formed. So types of cardiac amyloidosis, you have from the amyloid being deposited by the plasma cell disorder, as you see here with multiple myeloma, but you can also have genetic condition result from genetic mutation, or you can have the wild mutation result as we get older, as we age. This cartoon is very well demonstrate for us what is normal myocardium, what's abnormal myocardium, and what conditions result in amyloidosis. Specifically, in this case, cardiac amyloidosis. As you see on the left side there, you have plasma cells, but you also can have transthyretin protein being abnormally formed, result in deposit into the myocardium, and ultimately causing the heart to be damaged and not functioning well. Effects to the body result in mainly heart failure in what we call restrictive cardiomyopathy. As I mentioned, the heart is stiff, unable to fill completely or pump out adequate amount of blood. for us to function. It's also predispose our heart to arrhythmia. So a lot of these patients having various arrhythmia, including ventricular tachycardia, result in sudden cardiac death. And then, of course, it can also involve in other systemic organs, including the kidneys, the nervous system, and the digestive tract as well. The prevalence of this condition, as we age, more and more of us actually being affected by amyloidosis and not realize that we have this condition yet. I think with better diagnosis, we can make further definition and further diagnosis to our population in who actually resulting having this as we age, as our population get older as well. As you see, the symptoms result from mainly heart failure, shortness of breath, fatigue, palpitation from arrhythmia, but you also can have systemic symptoms such as carpal tunnel syndrome, peripheral neuropathy, enlargement of the tongue from the amyloid protein deposit in the organs, including the tongue and the muscle of the tongue as well. So the EKG electrical signal pick up very small amount of electrical energy compared to the echocardiogram thickening. And echocardiogram also show evidence of sparkling granular appearance from the amyloid protein being deposited into the myocardial tissue. Diagnosis definitively would be using the nuclear scan to detect evidence of fibrous material, the amyloid protein material being deposited into the myocardium. Of course, we also can do biopsy, but a lot of time we don't need to do biopsy. The nuclear test would allow us to correlate with the lab tests, which are the serum and urine evaluation for the amyloid proteins. Treatments, as you can see here, we have a variety of treatment: chemotherapy, immunotherapy, stabilizer, and various outcome has been demonstrated so far for the last 10 years. So the last 10 years, the treatment has improved survival. However, the prognosis overall is still poor. This cartoon here shows how we do the biopsy of the heart. But like I mentioned, we kind of get away from this now and more getting diagnosed by using laboratory and the nuclear scanning of the heart tissue. Treatment for amyloidosis, as I mentioned earlier, we have chemotherapy, but we also have medications for the last 10 years, mainly Acoramidis or Vyndamax, which is a brand name from Pfizer. But within the last 3 years, we also have newer medications such as Acoramidis from Attruby, from BBIO, and then of course guideline therapy for congestive heart failure syndrome also need to be instituted at the same time. Way to improve it would be, number one, if we can diagnose this condition more effectively and more available to our population to truly recognize the prevalence and incidence of this condition. And then of course, AI allows us to predict the disease progression and treatment response. Invasive or non-invasive evaluation would be the important diagnostic test, allow us to have earlier detection. And then of course, using RNA treatment, such as I mentioned earlier, for the newer medication will be the future of this condition in treatment to be more effectively. Immunotherapy, using this treatment to treat plasma cells that may result in what we call AL amyloidosis, will be also another effective way in making an advance in this condition.
You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.